In this video, we are going to be discussing the staining of carbohydrate in the histopathology laboratory. First, discuss what is carbohydrate and their function. Carbohydrate are organic component. This one composed of carbon, hydrogen and oxygen. Carbon 1%, hydrogen 2%, oxygen 1%, 1:2:1 ratio. Carbon, hydrogen, oxygen presented in that carbohydrate. It is an organic component. It can be sugars, starch and cellulose. The carbohydrate is presented in that form of sugar, starch and cellulose. Carbohydrate serve as the body major source of energy via glucose and also comprises the structure of cell membrane in the body. They are classified by the number of carbon atoms present within the chain and length of the chain. Of carbon and of course the location of that carbon group. The carbon group is where the carbon atom is double bonded to the oxygen. So monosaccharide are simply building block of sugars. Disaccharide composed of two monosaccharide bound. Oligosaccharide 3 to less than 10, that is 3 to 9 simple sugar linked together, and polysaccharide more than 10 to 1000 number of sugar molecules. So monosaccharide, this one is the simple unit. Disaccharide, 2 monosaccharide joined together. Oligosaccharide 3 to 9. Polysaccharide means more than 10. Glucose is a monosaccharide. Primary role is to act as source of energy for the body. It's soluble in aqueous solution because the solubility cannot be seen in tissue section. So this glucose is the monosaccharide. This one soluble in aqueous solution. Because of these characteristics, this one cannot be seen in tissue section. Then glycogen is the storage form of glucose in the body, most specifically in liver and skeletal muscles of the animals. So glycogen is the storage form of glucose. If somebody consumes excess amount of glucose, is converted into glycogen for storage, where it will store in our liver and skeletal muscles. This one having characteristics insoluble in aqueous solution. Glucose soluble in aqueous solution, this one insoluble in aqueous solution. That reason only we can see the tissue section. Some other carbohydrate, that carbohydrate are conjugated to protein and lipids. So this one monosaccharide, disaccharide, oligosaccharide, polysaccharide, what are the based on the how many unit of sugar we classified. Glucose only converted in the excess amount of glucose a person consumes, means that one will converted into glycogen. This one we discussed. Now that's carbohydrate are conjugated to protein and lipid. Based on that we classified 4 group of carbohydrate. Carbohydrate group 1. So group 1 carbohydrate containing neutral polysaccharide, that is it is presented in the form of glycogen, starch and cellulose. This one containing glucose. Second one is N-chitin. This one containing present in N-acetyl glucosamine. This one is presented in cell wall of fungi and arthropod. That means exoskeleton of insect, example crabs. This carbohydrate positive result in PAS reaction. Negative reaction with Alzian blue, colloidal iron and mucicaramine. So positive with group 1 carbohydrate, positive with that means PAS reaction, periodic acid ship reaction. Negative result in alzyl blue, colloidal iron and mucicaramine staining. So this is all about that classification, group 1 classification of carbohydrate based on their chemical difference. So this one is the neutral polysaccharide. Example, glycogen, starch, cellulose and chitin. Positive in PAS reaction, negative in alzyl blue, colloidal iron and mucicaramine. Second group carbohydrate classification based on the acid mucopolysaccharide. So group 2 carbohydrate classified based on acid mucopolysaccharide. It having 3 categories or 3 types. What are the 3 types? Carboxylated, sulfated and carboxylated, then sulfated. So 3 things: carboxylated, sulfated and carboxylated, then sulfated. This carboxylated group containing hyaluronic acid found in connective tissue and umbilical cord. So group 2 classification acid mucopolysaccharide, this having 3 types. First category, carboxylated one presented in hyaluronic acid, that one found in connective tissue and umbilical cord. Second one is sulfated and carboxylated. This one chondroitin sulfate ABC. Chondroitin sulfate ABC. The B is presented in skin, connective tissue, aorta and lungs. C presented in cartilage, chondrosarcoma, cornea and blood vessels. So sulfated and carboxylated chondroitin sulfate. B is present in skin, connective tissue, aorta and lungs. C is present in cartilage, chondrosarcomas, cornea and blood vessels. Third category, sulfated one. This one presented in human aorta and bovine cornea. So all of these groups are acidic in nature. So PAS reaction negative. So this group 2 carbohydrate containing acid mucopolysaccharide, 3 category: carboxylated, sulfated and carboxylated. Last one is sulfated. This one acidic in nature. So PAS reaction negative. Next one is group 3 carbohydrate. It contains glycoprotein in the form of mucin, mucide, mucopolysaccharide and mucose substances. So group 3 carbohydrate, mucin, mucide, mucoprotein and mucose substances. These also having 3 subcategories: neutral, carboxylated, sulfated and carboxylated. So neutral category contain ovimucide, mucin in stomach, beneath cell granules. So that beneath cell is a specialized secretory epithelial cell located in our intestine. So first category, neutral, this one presented in ovimucide, mucin in stomach and beneath cell granules. Second one is carboxylated. This carboxylated presented in sialoglycoprotein that containing sialic acid, no sulfate. So this sialoglycoprotein that containing sialic acid, no sulfate. The coelommucin is submaxillary gland mucin, small intestine mucin, fetal mucin, this one. Then upper part of colic crest and human sublingual gland it is presented. Then last one is sulfated and carboxylated. The glycoprotein in colic mucin of human and sheep. So group 3 carbohydrate category based on the glycoprotein, they have 3 subcategories. Egg white, that mucin, okay, then in that stomach and beneath cell granules. Then carboxylated group 1, glycoprotein that containing ceolic acid, it is presented in submaxillary gland, small intestine, fetal mucin, upper part of colic crest, human sublingual gland. Then sulfated and carboxylated, this one glycoprotein in colic mucin of human and sheep. Group 3, most of these are considered epithelial mucin. Some are in connective tissue. They are PAS reaction positive but not always. Group 3 epithelial mucin is considered epithelial mucin. Some are presented in connective tissue. Always can be PAS positive but not always. Next one is that group 4 carbohydrate category, it containing glycolipids. Glycolipids are lipids that have carbon attached to them with a glycosidic bond. So these are cerebrosides and phosphatides. Cerebrosides contain fatty residue bound to carbohydrate. So here fatty molecule bound with carbohydrate, that one is the cerebrosides. Then phosphatide, this one PAS positive. This phosphatide non-carbohydrate containing lipid. So first one having carbohydrate, second one non-carbohydrate. Example lecithin, cephalin, sphingomyelin. These are the example. This one is PAS reaction positive. Now, what are the special staining technique we use for carbohydrate? Listed here. What are the special staining technique? First one is PAS reaction. Second one is PAS reaction diastase digestion. Then Mayer-Musi-Caramine. Then Alcian blue. Then Alcian blue, first one is pH 2.5, then second one is pH 1.0, then Alcian blue with hyaluronidase enzyme, then Alcian blue PAS hematoxylin, last one is Muller-Maury colloidal iron. So these are the special staining used for carbohydrate. So what are the things? PAS reaction, PAS reaction with diastase digestion, Mayer-Musi-Caramine, Alcian blue pH 2.5, Alcian blue pH 1, Alcian blue with hyaluronidase, then Alcian blue PAS hematoxylin, then Muller-Maury colloidal iron. Then the special staining technique we used for carbohydrate, and it is important to know that purpose of stain, what are we using the staining for, it principle, and what reaction is occurring to causes it to stain, what type of tissue fixative or required for a special staining technique, as well as what section thickness of that tissue needs to be for this particular stain. When using this stain, we need to ensure that we have a quality control sample alongside to ensure the stain is working properly. So each stain is going to have a required quality control tissue type. We will also discussing the reagent required each stain as well as procedure. So some of the stain also have note about them as well as all these things will be discussed for each stain type. The first one is PAS reaction. So by using these special staining, we will know about that purpose of stain, the principle of stain, what are the fixative we are using, the section thickness of the tissue, and all the things we will discuss one by one. So first one is PAS, periodic acid stiff reaction. What is the purpose? This stain is used to see polysaccharide. So why we are using? To observe that polysaccharide, neutral mucous substances and basement membranes. So by using this PAS reaction, we can see polysaccharide, neutral mucous substances and basement membranes. What are the principles? This periodic acid oxidase tissue element to aldehyde. In principle, oxidation of elements to aldehyde. The periodic acid oxidize tissue element to aldehyde. The SIF reagent prepared by treating basic fusing with sulfurous acid. So here SIF reagent prepared by treating basic fusing with sulfurous acid. Leucofusin is formed, which is a colorless component, and following the SIF reaction, running water washes causes the visualization of the typical stiff color. Metabisulfite rinse used to remove excess stiff reagent. This help to prevent false coloration due to oxidation of any absorbent reagent. Here, what type of fixative we are using? 10% neutral buffered formalin or bovine solution. Here we will do blood smear in methyl alcohol for 10 to 15 minutes. That paraffin section cut 4 to 5 micrometer. In the case of kidney, 1 to 2 micrometer. Kidney sections are the best type of tissue for quality control. For PAS reagent needed here. So fixative 10% neutral buffered formalin or bovine solution. Blood smear with methyl alcohol for 10 to 15 minutes. In the case of paraffin section 4 to 5 micrometer. In the case of kidney section 1 to 2 microliter. These kidney section are the best type of the tissue for quality control for that PAS reaction. Reagent are needed. What are the reagent? Periodic acid 0.5%, 1 normality of HCl hydrochloric acid, then SIF reagent. This periodic acid, it containing 2.5 gram periodic acid plus 500 ml of distilled water. In the case of 1 normality of HCl, it containing 83.5 ml concentrated HCl and 196.5 ml distilled water. In the case of strip reagent, 800 ml of distilled water, 4 gram of basic buzene and 4 gram of sodium metabisulfite and 80 ml of 1 normality of HCl. Then potassium metabisulfate 0.55 percentage, 2.75 gram potassium metabisulfate plus 500 ml of distilled water. So these are the reagent required. Then we want to discuss procedure. Already what are the fixative, what are the reagent we are using discussed. Next, two type of procedure. One is conventional procedure, second one is microwave procedure. Conventional, for that slide must be used. So conventional, so here what we will do, so first method, conventional method. In this one we need a slide. Slide must be prepared by using blood. A slide must be prepared. Then deparaffinizes, hydrated to distilled water. Then this section must be placed 0.5 percentage of periodic acid solution for 5 minutes. Then wash with the distilled water for 3 changes. Then sift reagent, add in room temperature for 15 minutes. Then the section leave it for 1 minute in a jar of 0.55 percentage potassium metabisulfate to remove excessive staining. This one is the optional method only. Then wash with 10 minutes running water. Then we will add that Harris hematoxylin with acetic acid. Wait for 30 seconds. Then wash to blue hematoxylin. Then dehydrate by using 95% alcohol. Clear with xylene. Mount with synthetic resin. So that was the PAS conventional method. So first we prepared the slide. Then we add deparaffinize, then washed with the water, then add 0.5 percentage periodic acid solution for wait for 5 minutes, then washed with the distilled water for 3 changes. Then we will add this sift reagent, wait for 15 minutes. Then this section must be placed 1 minute in a 1 minute in a in 2 jar of 0.55 percentage of potassium metabisulfate. This one will removing excessive stain, but this one is the optional method only. Then wash with running water. Then Harris hematoxylin, wait for 30 seconds. Then washed with blue hematoxylin. Then dehydrate 95% of alcohol. Clear with xylene. Mount with synthetic resin. So this was about PAS conventional method. Next one is microwave procedure we want to discuss. There is also a microwave procedure. This procedure slide must be need. Deparaffinize, hydrate to distilled water. Then this section must be placed in a loosely capped coupling jar containing 0.5 percentage of periodic acid solution. Then put into a microwave oven heated. So 0.5 percentage periodic acid solution in a plastic coupling jar loosely capped. Put in a microwave oven for 15 seconds. Then wash with running water. Then sift reagent added. Okay, so in plastic coupling jar, high in microwave oven 10 seconds. Then stir and stand 30 seconds. Then wash with 5 to 10 minutes with running water. After that, the counter stain we will add Harris hematoxylin with acetic acid. 30 seconds. After that we will do wash with running water. Then blue nuclei in 0.75 percentage ammonia water. Then dehydrate 95 percentage absolute alcohol. Clear with xylene. Mount with synthetic resin. So a microwave procedure, we will put that slide to that microwave. Here counterstain Harris hematoxylene. Then dehydrate with 95 percentage alcohol. Then clear with xylene. Mount with the synthetic resin. Then pass a reaction result. It shows bright rose color. Bright rose color in the slide. This is the colon section with a small pup that is stained with a PAS reaction and counter stain hematoxylene. That bright red color shows positive pass reaction. This one is the colon section stained with PAS reaction and counter stain hematoxylene. It producing bright rose color. PAS reaction positive in glycogen, neutral mucous substances, sudden epithelial sulfomucin, xylomucin, colloidal material of thyroid. Then basement membrane and fungal cell wall. All these are considered as PAS reaction positive. Then how intense a tissue section with PAS reaction? In intensity due to number of available 1,2 glycol groups. 1,2 glycol groups. Reactivity of stiff reagent. Structure of polymer oxidized. Reaction condition occurs due to 4 different factors. So intensity due to number of availability of 1,2 glycol group. Reactivity of stiff reagent. Structure of polymer oxidized. Reaction condition occurs. So intensity occur due to 4 different factors. Fast green counter stain can replace hematoxylene for fungi. 1 minute in 0.02 percentage fast green with 1 drop of acetic acid for every 60 ml staining solution. Then tap water wash for color development. Then glutaraldehyde cannot be used as fixative. React with a stick reaction. Then control slide through all the steps except periodate oxidation. If staining with fungi, fast counter stain replaced for hematoxylene. For fungus, 1 minute in 0.202 percentage fast green with 1 drop of acetic acid for every 60 ml staining solution. After color development, wash with water. Then glutaraldehyde cannot be used as a fixative because it will react with a stiff reaction. Then control slide through all the steps. So this is all about PAS reaction.